Hi, welcome to the Tao Talk podcast. My name is Denise, and I am here with my co host, Neil. And today I'm going to give you a brief update on healthcare. So, if you guys have been following this podcast for a while, you know that, we've talked about the fact that I am on ACA. In New York, it's called New York State of Health. And I had a lot of concerns about rate increases. I'm a business owner, so that's how I get my health care. That helps me to have a more affordable rate. It's still higher than what I paid when I was an employee in the city, but then again, healthcare wasn't as expensive then as it is today. So I did finally get the chance to sit down and run through, and thankfully, but I didn't realize is that New York State of Health is also subsidized by New York because I did get a subsidy. Not as much as I would have if I had the benefit of the other ACA subsidies, but I did get some and it did help me. But long story short, to get the same coverage that I have and the same plan that I have, it still is going to cost me a little over $300 more per month. So that's $3,600 a year over what I was paying before. So it is an increase. Thankfully, it's just for me. If I had a family, it would probably be higher. But I guess I can say I'm grateful to have been in New York because the policy itself went up a little over $100 before the subsidy, and then of course I got less of a subsidy, and bottom line, that's what it cost me. So, what can we say about this? Come to New York. If, this is the benefit of living in a donor state. People like to sit here and trash New York, trash California, trash Illinois. Oh, you guys, your taxes are higher. And well, this is the benefit of what we get out of that is that we can get an offset for health care through the ACA or in this case, New York State of Health program. So what do you think, Neil?
Listen, if we had Medicare for all, it wouldn't be an issue.
Wouldn't be an issue. Wouldn't be an
I
issue.
I think I've talked about it a million times, right? Like it's the idea, people without your healthcare being transportable, people, there are a lot of people stuck at their jobs, because of healthcare. A lot of people don't start their own business because of healthcare issues. A lot of people, they go into medical debt. They can't afford, to take care of themselves. When they do have a medical issues go on longer than they're supposed to, and they turn out to be minor medical issues, can turn out to be major medical issues
Oh,
later
yeah.
on, which could end up bankrupting people. The United States is the only country, right? The only modernized country or first world country in the entire world where people can go bankrupt from medical bills,
Yeah. Yeah.
right?
We
But
have
I guess
talked
that
about
makes us
this.
we're number one. We're number one. We're number
Yeah.
one, right? Like
The
because
hottest country. Yeah,
we're
because we're
we're
on
we're
fire.
we're the first. We're number one. We're the number one in medical bankruptcies in the entire world, right? Like I mean, it's I I, I
It shouldn't
it
happen
was
in this country. It just shouldn't.
I've heard it a million times, right? We're the only, the United States is the only country, right, in the entire world where billionaires tell you that things that are for the common good are not good for you, right? And they believe them.
Oh,
Right?
yeah.
I mean,
Yeah.
it's horrible. Like it's just absolutely horrible that people have to go through this every year. And it's a lot of stress, especially
Mhm.
during the holiday season when you're already stressed out. Um, there's just a lot.
Yeah. So I'm gonna, give you sort of I'm doing math over here, just to add up. So, um, my husband is, a senior. He's 67. My birthday is this I'm not quite a senior yet, but my birthday is this month, and I'm getting there. Barreling down that hill. So, let me see, equals here. So for the 2 of us, the cost of my health care alone, just my health insurance, and then I also, added a dental plan, and, that alone puts me at almost, $900 a month for my healthcare alone now, where I was paying under 600 last year. I thought that was a lot, right? Before then, I think I was about $100 cheaper, right? So,
I was
but
at
then
1,200 when I was on it back in the day.
yeah, oh my god, that's for just one person or for your family?
It was me and my daughter.
You and your daughter, so it's a family plan.
Yep.
Um, yeah, yeah, because they usually count that together, as one fee. But that's just, that $900 is just me, and then when you factor in, the rest of my husband is on Medicare, and then we have a, supplement plan altogether for the 2 of us just paying healthcare alone outside of deductibles, outside of copays. It's just about $1,300 for an aging couple here in New York. At a point when we're at a point where we need medical more than, because
Same coverage too, right? It's the same
I
coverage
went
too,
with
and
the
that you
same
didn't have to go
plan.
down you didn't have to go down a plan, right?
Right, no, and you know what? I could've, but here's the thing, I did notice this. This was one thing that was different from previous years. The subsidy that was coming to me was only available on silver plans. So they took away the subsidy for bronze plans. So bronze or the catastrophic plans, you don't get a subsidy, but the rates are considerably lower. But at the same time, the deductibles are way higher. So the deductible that I have is under $1,000 a year, which is really good. God forbid I
Sure.
need to go and get things. But if I went with a bronze plan, I think just for me, the starting deductibles like 5,500 or 6,000. And so you're just paying that out of pocket. That becomes another expense. If you do have medical testing that you need and you have a bronze plan and you're already paying, let's say, $600 a month for the plan, and you have to meet a $6,000 deductible, well, all that adds together for your annual cost. Because if you do use that plan and you do get treatment and it exceeds $6,000, well, that's part of you've just laid that money out for your premium. You know what I'm saying? And it ends up being very costly, right?
That's a tax. And again, I go with that's a tax. That's a tax. Okay? As much as I understand you're paying a private company, it's a tax, right? Because it's a mandatory expense that you have to pay that every other first world country in the entire world, with maybe I think the exception of the Philippines, which has
Well, they suck
our
anyway.
system, which has our system, um, gets state-run healthcare.
Yeah. Yep.
So it's and this idea that state-run healthcare bullshit. Medicare is one of the best healthcare, that some of the best healthcare that we have in the United States is Medicare. And the only reason why I hear people say it sucks is because of what they privatized. The pieces that they privatized absolutely suck.
Yeah.
Okay?
Yeah.
The government plan is one of the most efficient plans run in the United States. Only 5% goes to administrative costs, and there absolutely is no profit. You heard, who was it? Lindsey Graham, right? Like he flat out said, well, the reason why we don't want to give the subsidies out anymore is because 20% of everything of the money that's given to healthcare companies, your premiums go towards profit, right? They have a 30% administrative costs and 20% goes to profit. So the real question is how, of the money that you spend, only about 50%. So if for every dollar you give to your insurance company, only about 50% or 50 cents goes to your actual health care.
Think
Whereas
about that.
95, right? So whereas if you're on Medicare, right, 95 cents out of every dollar goes to your health care. Right? Again, I go with money. Look at the money. Stop like with the nonsense of the isms, capitalism versus socialism versus this versus that. It's all bullshit. It doesn't mean actually anything, right? And look at what's best for you,
Yeah.
right? Especially in rural areas where hospitals are closing down.
Yeah,
You know,
that they're really gonna be hit hard, those communities. They
yeah,
it's starting to happen. It's starting to
we're
happen. When I
feeling it
t
here. We're
Yeah,
feeling it here. You
yeah.
know, we're not that far from a major city, and
Let
you know you could call Middletown a major city if you want, but we're not far, and
Oh, yeah,
it's
yeah,
already impacting us.
and I can tell you that right now because I, followed up with my endocrinologist, on was it last Wednesday? And she announced that, she's the PA for the endocrinologist, but I treat with her. Many of us treat with PAs now versus actual doctors, and because they're overseen by a doctor. And she announced that she is leaving in March. So that was my last appointment with her. And I'm going to follow up with my regular physician. And when I talked to her about why, she said it's because the endocrinologist at Middletown Medical, I'll just name the place, Middletown Medical, is retiring and they don't have another endocrinologist. And therefore, she cannot practice, right? She can't see people without being overseen by a doctor. And the facility can't find another endocrinologist to take retiring one's place. And that's a travesty. So basically that department is going to suffer entirely. They may lose that department if they don't get another um endocrinologist and MD in there. It's
There was there was a there was a story a number of years back of a doctor, a cancer doctor, right, that treated that they treat cancer patients, right, and they had their own private practice. He had to close down his practice because he said he couldn't afford the insurance anymore because he was in such a specialized field, right? That utilizes, experimental drugs or very severe drugs, and it has a high rate of unfortunately death, right? Um, the insurance premiums were beyond what he could afford and what he made in his practice for him to be able to and we all say doctors make a ton of money, right? It's just not true anymore. It's not like the olden days, and it's not. I mean, the insurance companies really take large
they're the ones that
chunks.
making the money.
Right. They take large chunks of people's money, and there are certain practices maybe where doctors can make a good living, but they're it's not like the olden days. Insurance companies really have a stranglehold, and now your doctor isn't even treating you anymore. It's the insurance company, right? So before
Yeah,
they can even treat you, before they can prescribe a medicine, before they can authorize a treatment plan, or an MRI or a CAT scan or
or
ultrasound or whatever it is that
surgery.
you need, they have to get approval from your insurance company. So your insurance company is really your doctor now, right? And those days in the 90s when they said you should have the right to choose your own doctor are way gone. Politicians don't give a shit about that anymore. And now it's become, you should not have a right to have your own insurance company. Like as if your insurance company is the one treating you, or the insurance company is the one that has your back. Like I don't really give a shit about my insurance company. I just want them to pay the fucking bill,
Yeah,
right? I care about my goddamn doctor. Okay. And these politicians who talk about insurance companies and take out the doctor, like they need to go. They have no courage.
yeah.
No, again, I go back to they have no courage, right?
Mhm.
So I'll tell the story again. I told it on the last podcast. I'll tell it again. Hakeem Jeffries was asked about the healthcare question. He was given a thing about the healthcare question, and he was asked about universal healthcare, and his response was, "Well, I've always been for universal healthcare, but it's never come up, right, on the House floor for a vote.
Oh,
So
gee,
I've
well,
never
maybe you
had the
should write a fucking bill, huh? How about
right,
that?
or sponsor a bill, or you are the minority leader in the Senate, right? Or in the House, right? You could be a Speaker of the House, or you want to be Speaker of the House, right? How about putting forth a bill? Not only that, there were two bills. There was a bill in the House and a bill in the Senate that was introduced by a congressman and a senator, right, back in March of this year, right? So Hakeem Jeffries did nothing to promote that, to sponsor that, to right like so again I go with his actions don't match his rhetoric, right? He has no courage, okay? He has no conviction and no integrity. Okay. And that becomes a problem, right, for Democrats because Democrats are in this crisis, right now of who they want to choose as their leaders moving forward. Do they want to continue the cowardice of the current political leadership, or do they want more courage from political leaders that are willing to stand up for Americans and Americans' rights and the people within America who live here and who want to make America work for Americans and everyday Americans on a daily basis. And this is one piece of the affordability crisis
Yeah.
that we are all dealing
Yeah.
with, and it's a major piece, along with housing, along with
Oh, yeah.
with everything else. This is another piece, and it's just another thing that our politicians have laid upon us, saying, "Oh, well, I can't do that because it's socialism," right? Anything they don't want to do, or anything the billionaires don't want, they just label socialism, and that's it. And
Uh,
and and all of a sudden we don't want to do it. They don't give you an explanation of why they don't want to do it, right? They just say we don't want to do it. As I've pointed out on this show a few different times, okay? They if they did universal health care, if they did Medicare for all, every single person would get a raise at work, okay?
yep.
And it would cost less money overall in our system to pay for health care. Currently, the United States has the number one, again, number one, we're number one. All right. We are the number one in healthcare costs, in the cost of healthcare, right, in the United States. That we spend more on healthcare than every other industrialized world in every other industrialized country in the world. Okay.
And so, well, that's because billionaires have discovered that healthcare is a great way to make a profit.
Make a profit off of sick people.
Yep.
And what have we said, right? If you want to look at any problem, look at who's profiting. Okay. And
There's
what you could say is that the United States, we profit off of illness,
Oh,
right?
yeah.
There is absolutely no reason for doctors or anybody else to make us better, right? Because they're all profiting from keeping us sick,
Right.
filling us with poison, right? Prescribing poison to us, just continuing the illness and sickness. The funny part is we talk about the opioid crisis being a worldwide crisis. It's a United States crisis, believe it or not. It's not a worldwide crisis. It's a United States crisis.
Mhm. I believe that.
Okay. These things that we talk about, the drug war is really just a US war on drugs. Other countries don't have these problems because they have laws in place and they have good social programs and they have health care.
Yeah. And so they don't have crushing debt underneath them because of healthcare costs. I mean, look, if you're young and you're healthy and you're fine, you're not feeling these costs. But when you get married and you start having kids, or you work or maybe you're active and you're engaging in risky sports and you get injured and I don't know, crack 3 ribs or break a hip or something, and suddenly you need healthcare. Suddenly, maybe you have a permanent injury that will prevent you from working in your previous career. Suddenly you get to experience what those costs are. And then you realize, oh shit, I needed health care. you know?
Oh shit. Yeah,
Eh,
that's what you're gonna say. You have a healthcare problem. First thing you're gonna say is, "Oh
oh,
shit."
shit. That's kinda where we are now. I mean,
Right.
when you think about the people who are going to lose healthcare, I mean, okay, I'm paying a good chunk more. Basically, the cost of my healthcare has gone up 50% because I was paying 600 and I'm now at about 900, for
Yeah,
for
so
for just me
50%. So it
alone.
actually so it went up 50%
Went up
for you for
50%,
you for you alone.
but
That's a
there are
lot
peo
of money. Like that's
that's
a
a
lot. That's
lot
a
of
lot.
money.
How about we talk? So let's not talk about dollars. Let's talk about since these politicians love talking about percentages. I talked about percentages versus dollars before, and one
Yes,
of
you
our
did.
previous. Your healthcare went up 50. Stop talking about real dollars. 50% your healthcare went up.
Yeah, 50%. That's exactly what it did,
Think
and
about that, people. Think about that. Her healthcare went up 50%, right? Imagine you're on a fixed income, right? Because I mean, your income didn't go up 50%,
oh, hell no.
right? Your income didn't go up 50%, but your healthcare did. You have food prices that have gone up probably what 15-20% over the past year,
Oh, yeah.
right? You have other expenses that are going up, right? And healthcare is now 50%.
And that's just for me. In other states, I'm lucky to be in New York that I was able to get a subsidy from my state. But if you live a lot of these states, sorry, but they're mostly red states that are recipient states, not donor states, they're not getting anything. And so they're watching their premiums. And if they have a family and they have kids, then the premiums are already higher to begin with because you're covering more people. It's devastating. We need universal health care. We need it now more than ever because the costs have climbed so much just in recent years. And if there's ever a platform to campaign on, that's 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 the heart of the affordability crisis because healthcare when you have healthcare premiums that can match a rental payment or a mortgage payment, that's serious. It's a choice between healthcare or a roof over your head at this point.
I'll go back to they just want you to die and stop using their energy and their water
Yeah,
because they need that for their AI. Getting back to AI, it all comes
yeah,
back to that, right?
eh,
Comes back to they don't care. They don't really care about you,
yeah,
right? And what we see is that these politicians all have their health care. They have lifetime health care. Think
that we're
about that.
paying for. We
That
pay
we're
for it.
right. We're paying for their lifetime health care, and then they turn around and say, I don't have the votes to give you the same that I have, that you are helping me pay for. I can't give to you.
Right. This is this
Okay.
is the c this is America today.
Right. This is, there's a, so I don't know if anybody's seen History of the World. If you've seen History of the World by Mel Brooks,
Oh,
right?
yes. Yes.
There was a scene in History of the World where they go, we could build, houses for the poor, or we could build it, right? Or we could give ourselves raises, right? And like they were like, they all stood up, everybody in the Senate stood up and said, screw the poor, right? I
Yep, that
mean,
it's
that's
funny, but it's true.
but that's never been more true than it is today, right? Both Democrats and Republicans in Congress have all said screw the poor.
Yep.
And for this is the sad part is, right? This is exactly what the Tea Party started out as. This is
Right.
what the Tea Party started out as. The Tea Party started out as an insurgent group into the Republican Party because they felt that the party didn't represent who they were as individuals, right? That there was corruption, and immediately they got in, and the billionaire class, the donor class, immediately convinced them and pumped out there this nonsense, this propaganda, and people bought into it because it became believable because these politicians are corrupt. They
Oh,
don't
yeah.
have the interest of the people. You know, the far left and the far right are really the same. You know, as much as everybody thinks that they're not the same, they really are the same. They really want America to work for all Americans.
Yeah.
You know, it just happens to be that and I've always said it this way, right? The far right believes that the only way that that can happen is through just tearing down the old and rebuilding everything anew, right? And what we found is that what that means for them is really all white, right? Like
Oh,
it
yeah.
has to be working for all white. Whereas Democrats, right, the far left and Democrats say we can take the institutions in place and make them better.
I like that idea.
I struggle. I struggle with both. I really do because I think some institutions need to go. I think they're antiquated. I don't think they run properly, and I think that they need to be torn down and thrown out and start anew. And I think that I think some combination of both, right? Like, and then some institutions, you know, I think have really good bones to it that can be like Medicare has really good bones to it.
Yeah.
That could be a really good program. Social Security has really good bones to it, really good program, really works. The people there that really want it to work, we can make it better, right? We can make those programs better. You know, I've long thought that the Department of Education has not worked. You know, I've been one of those people. I've really, I think it has really, it was meant to raise standards. I think it kind of lowered standards in the United States. Unfortunately, it
So,
didn't have the
but
mechanism to do what it did. But
well,
sorry,
let
I'm
me
getting
stop you
off
there.
topic though.
No,
I'm getting way
but
off
I'm
topic.
gonna
I'm
stop
tangent.
you there by just saying that tearing down isn't necessarily the answer. Then the answer is maybe a thoughtful reimagining of the Department of Education or of those institutions that either need to be rehabilitated or need because look, we just went through this whole Doge thing. They tore through everything it's
Yeah.
caught, and we see
I'm not
how
really
how
seeing.
dist
I didn't think that
we're
that was the right way to do it. But yes,
no,
I get what
no,
you're
we
saying.
need people, like, threw back to Clinton, and when Clinton went through the bureaucracy, he did it in a very thoughtful way. He sat down with the department leaders, and they looked at, staffing. Did we are we paying too many salaries? Are there ways we could sort of consolidate work, way we can streamline practices? That's when government is doing the right thing, when they're looking at the process. Same thing with approach to healthcare. There's a way to do this in a thoughtful way that's efficient, gets the job done, and does good work for the people. But coming in and just ripping government apart, that was a completely different process. And we could do a
Well,
whole podcast on that. And I think we should.
right.
Because,
And I don't want to get into that topic. I mean, we could talk about Clinton, but Clinton really perpetuated the outsourcing in government, which is really gutted, the good work that was being done. And a lot of those departments, and with that really kind of laid the foundation for what Trump and Doge did, right? Like, listen, I know Democrats will hate me for saying that, right? Because
well, no,
Bill
I am
Clinton
not.
is a great is but these are all true things, right? These are all things that have been historically written about, and talked about. And, you know, getting back to the healthcare, right? What we were talking about with healthcare, um, this is this is really a huge failure that
Oh, yeah.
started a long time ago. And just, it's this capitalism on steroids of, commoditizing every piece of our society, can be used and made into a
To make
profit
a
center
buck. To make a
to make a
buck.
right.
Make a buck
And
off of disease and illness. Think about that. That's just
we
disgusting.
we are just commodities. We are just pawns. Like we are, and this is part of the issue, right? This is what both sides, again, the far left and the far right, have an issue with. It's the fact that we're just pawns,
We're
right? This
pawns
is this is
to
supposed to be
leeches. They're
our
leeching
country,
off of us.
right? This
Yeah,
is
it's
supposed to
supposed to
be
be.
our country. Our politicians are supposed to work for us, and they don't. They
Nope,
don't.
nope.
Right? They put on a good show. Listen, I read, I think I talked about it, but, Marjorie Taylor Greene, she goes back to her district. She's a boss, right? She helps everybody in her district, right? They fucking love her because she does such a good job for them, in her home district. Okay. But she then goes and advocates against what their needs are, right?
Yeah,
She goes to Congress and advocates against them. It's this idea that people you're sending to Congress may do good work at home. Like they may help people get visas and they may help like individual people do, but that's the basics of their job, right?
but
That's the basics of their job.
but
And to
when
be
you're
honest with you, what
legislating against those
right,
people, that's
right.
the that's the big one.
You're legislating so that you as a politician don't have to help them anymore because you're going to take away a service that they're getting that you're working hard so that they can keep, right? Only to legislate with them on the other side and so that they don't get that benefit anymore. Right? Because if they don't have the benefit anymore, then you can turn around and say, well, I can't help you because the benefit isn't being provided anymore.
Yeah, well, why'd you vote it out then, asshole?
Well, they blame somebody else.
Well,
That's when
that's
that's when
what
they
it
go and
is.
blame
Eh,
somebody else. Everything
That's
else
what.
is always somebody else's fault.
Yeah, it's a blame game. This is
Right.
the most. This is the most finger pointing government regime I have ever seen. It's you did it. You did it.
They all finger point. Democrats
It's
finger point too.
nobody
Give me a
nobody
break.
takes responsibility. Nobody owns anything. Nobody
No
owns their
courage,
shit.
no integrity. No
That's what we're.
courage, no integrity.
So,
So,
folks,
and that's what we need.
we need that. We need universal health care. Democrats, democratic socialists, tea parties, whatever the fuck you are,
Medicare for all.
independents. Yeah, we need Medicare for all. People need this. I want to see that for you. Want to see that for everyone. Don't care whether you're MAGA or not. You all deserve it. We all deserve it. This is our country, and that would be our tax dollars working for us. So think about that, folks. All right. So thanks so much for joining us. We obviously have more content coming to you. Just a reminder, tomorrow is Monday, December 9th, and we are going to be doing our live podcast, our live stream at 7 p.m. Monday, December 9th, instead of Tuesdays, like we normally do Tuesdays, 7 to 8 p.m., because Neil has a holiday party. He's going to be drunk as a skunk, and we're going to get the pictures. We're going to post them out on Instagram, and we're going to get, we're going to get it, oh, yeah, we're going to get the photographic evidence. All right. So anyway, oh, by the way, how do you like our cool background, our holiday background? We're trying to keep it festive for everybody. All right. So anyway, thanks so much for watching. If you've got comments, if you have questions about healthcare, let us know. Let us know what you think. Were you on the ACA, not on the ACA, or if your premiums in general have gone up? Let us know. This is definitely a conversation that we need to have. All right. Please remember to like, share, and subscribe. Thanks for much watching. We'll see you soon. Take care.